You would have seen that patient who came with a hypokalemia and an ECG change or weakness and got admitted through the emergency department and is now receiving potassium supplementation. How do you know whether he is losing potassium renally? But the big trap is that anybody who is getting potassium supplements will have increased urinary potassium excretion. So renal potassium is not readily available to say this. Renal potassium handling depends on distal sodium delivery, aldosterone activity and tubular flow rate. So when you give potassium supplements, filtered load of potassium increases, distal nephron secretes more of potassium. So urinary potassium reflects recent intake, not necessarily pathological wasting. This makes spot urine output misleading in supplemented patients. The former convention was that urine potassium of more than 20 millimoles is renal loss, less than 20 millimoles is extra renal loss. But when the patient is on supplementation, these thresholds fail to identify patients who are losing therapy. So in addition, you can do a urinary potassium to creatinine ratio. 24-hour urinary potassium is also another way to look at this. In true renal potassium wasting, hypokalemia persists despite adequate replacement and urinary potassium remains disproportionately high even after withholding supplements. In metabolic alkalosis, even normal kidneys increase potassium excretion. So context is everything. So what experienced people do is that they hold the potassium supplement for 6 to 12 hours if safe and then check the spot potassium or spot potassium creatinine ratio. Then interpret the acid-base status. In a metabolic alkalosis, high urine potassium, think of diuretics, Barter and Gittelman. In normal or acidotic patient with high urine potassium, think of renal tubular acidosis or mineralocorticoid excess. Never interpret urine potassium in isolation. So in hypokalemia, on supplements, urinary potassium reflects intake, not the diagnosis. Always reassess after holding for a brief time the replacement.